Assessing for left-sided cardiomegaly is important. Many common congenital and acquired diseases of the heart result in left-sided cardiac enlargement. Left atrial and left ventricular enlargement are a hallmark radiographic finding in patients with left-sided congestive heart failure. To identify left-sided cardiomegaly, you need to understand the normal size and shape of the cardiac silhouette. Additionally, you need to be able to identify potential pitfalls that lead to false positive diagnosis of left atrial enlargement. The left atrium in a canine patient is located along the caudodorsal margin of the cardiac silhouette, tapering in a craniodorsal direction. This is highlighted by the dotted white lines and is referred to as the cardiac waist. On the ventrodorsal and dorsoventral views, the left atrium is located between the caudal mainstem bronchi, which normally form a V shape as they bifurcate. This is highlighted by the dotted white lines. Left atrial enlargement can be identified by a straightening or convex bulge along the caudodorsal border of the cardiac silhouette. Let's have a look at an example of left atrial enlargement in this 12-year-old male castrated Yorkshire Terrier with confirmed myxomatous mitral valve disease. Take a moment to list your radiographic findings for the provided right lateral and ventrodorsal views for this patient. Pause the video here if needed. Let's look closer at the right lateral view shown in the left image compared to a normal canine patient shown in the right image. The normal craniodorsally tapering margin of the cardiac silhouette or cardiac waist, as noted by the dotted white line in the right image, is lost due to a soft tissue bulge in the region of the left atrium. This soft tissue bulge along the caudodorsal margin of the cardiac silhouette and loss of the normal cardiac waist is highlighted by the dotted orange line in the left image. If left atrial enlargement is suspected on the lateral views, the orthogonal ventrodorsal or dorsoventral view should be assessed for supporting evidence of left atrial enlargement. On these views, left atrial enlargement is identified by abaxial displacement of the caudal mainstem bronchi. The standard V-shaped bifurcation of the caudal mainstem bronchi, outlined by white dotted lines on the right image, is laterally or abaxially displaced. This is outlined by the orange dotted lines on the left image. Additionally, on the ventrodorsal or dorsoventral view, you can sometimes see a double opacity in the region of the left atrium between the mainstem bronchi, outlined by the orange arrows. This occurs due to the focal increase in soft tissue thickness, attenuating the X-ray beam due to left atrial enlargement, outlined by the orange solid line on the lateral image, compared to the caudal aspect of the cardiac silhouette outlined by the white solid line. In the normal heart, the caudal margin of the cardiac silhouette gradually tapers, noted by the dotted white line. This gradual change in the thickness of the cardiac silhouette extending to the cardiac apex, outlined by the solid white lines in the right image, results in the lack of a distinct, well-defined margin of the left atrium when it is normal. Pitfalls encountered when assessing the left atrium include overcalling left atrial enlargement due to mistaking pulmonary vein insertion at the left atrium for straightening of the caudodorsal border of the cardiac, silhouette, or mistaking tracheobronchial lymphadenomegaly for left atrial enlargement. The pulmonary veins inserts upon the left atrium, mimicking straightening of the caudodorsal border of the cardiac silhouette, as noted by the white arrows. Other similar structures mistaken for left atrial enlargement includes superimposition of a rib over the caudal margin of the left atrium. In these cases, close examination of the opposite lateral view to identify persistent straightening or convex bulge in the caudodorsal aspect of the cardiac silhouette may help clarify if there is true left atrial enlargement. Observe how the cardiac silhouette tapers cranially in the right lateral view of the same patient, outlined by the dotted white line in the right image. Additionally, identification of abaxial displacement of the caudal mainstem bronchi on the ventrodorsal view would support true left atrial enlargement. Let's look at the right lateral and ventrodorsal views in this 8-year-old female spayed Cocker Spaniel. In this patient, we identify a soft tissue opaque bulge along the caudodorsal border of the cardiac silhouette with associated loss of the normal cardiac waist. This is outlined by the white arrows on the left image. Concurrently, on the ventrodorsal view, there is abaxial displacement of the caudal mainstem bronchi, outlined by the dotted white lines in the right image, with double opacity between these bronchi outlined by the white arrows in the same image. While these are radiographic signs associated with left atrial enlargement, there is one small differentiating factor. If you examine the right lateral view closely, you can identify that this soft tissue mass effect is causing ventral displacement of the caudal mainstem bronchi, outlined by the orange arrow in the right image. Additionally, see how the soft tissue opacity extends cranial and dorsal to the carina. Left atrial enlargement would be unlikely to extend cranial to the carina. Tracheobronchial lymph nodes are located between the caudal mainstem bronchi and can mimic the abaxial displacement of the caudal mainstem bronchi caused by left atrial enlargement. This can be differentiated from left atrial enlargement by ventral displacement of the mainstem bronchi. This is outlined by the orange arrow on the left image. Whereas left atrial enlargement typically results in dorsal displacement of the caudal mainstem bronchi, outlined by the white arrows in the right image. In summary, left atrial enlargement in canine patients can be identified by straightening of the caudodorsal border or soft tissue bulge along the caudodorsal border of the cardiac silhouette on the lateral views. This loss of the normal cranially tapering caudodorsal border is referred to as a loss of the cardiac waist. This is further supported by abaxial displacement of the caudal mainstem bronchi on the ventrodorsal view and double opacity between these mainstem bronchi. Some pitfalls that may lead to false identification of left atrial enlargement include mistaking insertion of the pulmonary vein at the left atrium for pathologic straightening of the caudodorsal margin due to left atrial enlargement, and mistaking tracheobronchial lymphadenopathy for left atrial enlargement. If you have found this video helpful, please give a like and comment on the content.